Well, good evening and welcome to our webinar. I'm Dr. Rita McGuire. I'm the Chief Medical Officer for Wakanna, as well as one of the co-founders. And I want to welcome each and every one of you on the line. Hopefully, we've got a lot of new guests on the line. And tonight, we're going to be talking about the surprising connection between Tylenol and CBD. I'll first start out with our disclaimer that these statements and products have not been approved by the FDA. If you are pregnant, nursing, or on medication, please consult with your physician prior to taking any nutraceutical products. So let's talk about Tylenol. Tylenol is the brand name for acetaminophen. And many of you on the line have taken Tylenol at some point in your life. Maybe you're still currently taking Tylenol, but Tylenol not only is a pain reliever, but it's a fever reducer. We use Tylenol, and many of you on the line have used Tylenol to treat headaches, muscle aches, pain due to arthritis, maybe backaches, toothaches, colds, and even fevers. But what is important to know are the potential side effects from a benign medication that's over the counter like Tylenol. And the most concerning side effect for Tylenol or acetaminophen is acetaminophen poisoning. Consuming too many Tylenol, large amounts of Tylenol, can cause liver damage. In fact, it's estimated that 23% of Americans take Tylenol at least once a week. 23% of Americans really computes to between 50 and 74 million people take Tylenol at least once a week. In fact, acetaminophen or Tylenol is the most common drug ingredient in America. It's found in over 600 different prescriptions and over-the-counter medications. Using Tylenol is safe and effective if you use it as directed. And more than 95% of the time, it is taken according to directions that are found on the label. But the ones who overdo it, and many times we are all guilty of taking too much pain medication, right? Maybe we are taking it too soon to the next dosing time, or maybe you're not aware that there is Tylenol or acetaminophen in other medications that you may be taking. So that compound effect can be deadly. Or sometimes we take too much at one time. So the maximum dosage for Tylenol, if it exceeds a maximum daily dose of 4,000 milligrams, this can lead to liver damage. So how does Tylenol work? Have you ever thought about it, like when you have a headache or a toothache or maybe a backache, or maybe you just overdid it in the gym? How does Tylenol work? Well, Tylenol belongs to a class of drugs called analgesics. Those are pain relievers, and antipyretics, and those are drugs that reduce fever. The exact mechanism of action is not really clear, but we do know that Tylenol can reduce the production of prostaglandins. Now, see, prostaglandins are chemicals that cause pain and inflammation in the brain. So, however, Tylenol doesn't possess an anti-inflammatory property, it does help to relieve pain by elevating the pain threshold. It also reduces fever through the action on the heart regulating center in the brain, the hypothalamus, to lower our temperature when it's elevated. So again, not only is Tylenol or acetaminophen in a class of painkillers, they're referred to as non-opioid analgesics. The other medications that are included are drugs like aspirin. We've all taken aspirin at some point or another, ibuprofen, naproxen, or Celebrex. So all of these painkillers work by inhibiting an enzyme called cyclooxygenase, or just think of the word COX. COX is important in converting fatty acids like arachidonic acid contained in the walls of our cells to prostaglandins. And remember, prostaglandins are relevant to pain because they produce inflammation and cause pain in our body. They also elevate body temperature, again, by affecting the part of the brain that regulates our temperature. So non-opioid analgesics like Tylenol and aspirin and ibuprofen and Motrin and naproxen and Celebrex, they all work because they block that COX enzyme, and subsequently they block the production of prostaglandins, which in turn, when you block that enzyme, reduces fever, it reduces pain, and it reduces inflammation. But what's interesting about Tylenol, it's a little bit different than aspirin and Motrin and ibuprofen and Celebrex, is that Tylenol doesn't block that COX enzyme in the peripheral nervous system. So when we use the word peripheral nervous system versus central nervous system, we all know that the central nervous system is the brain, but the peripheral nervous system is the system that controls and regulates pain and inflammation outside of the brain. So areas in our knee, areas in our shoulders, areas in our back. So experts believe that acetaminophen or Tylenol reduces pain in the central nervous system by inhibiting that COX enzyme, but there's a lot of debate if it really works in the peripheral nervous system. So that's why Tylenol is considered a weak analgesic when it comes to reducing inflammation. So let's look a little bit more on pain and inflammation, because it's estimated that 100 million people suffer from pain every single day. In fact, in 2015, the National Institute of Health, the NIH, said that not only do 25 million people suffer from pain, but inflammation is a major source of their pain. Arthritis is another source of pain and inflammation, and even neuropathy. I'm sure if you're on the line, you've heard of maybe a loved one or someone you work with that has neuropathy. Now that's inflammation of the nerves, and that can happen from an injury. It can happen from having uncontrolled diabetes and even hypertension. And we know what happens when we have pain and inflammation and we can't get it under control. What happens? Well, we become very anxious, we become depressed, because not only does it cause the quality of our life to be compromised, we can't do the things that we love. You may be out there and you love to roller skate, or you may love to run, or you may be very active in your garden. All of that causes a quality of life to be diminished when you have inflammation and pain that is not controlled. As well as inflammation in the brain can cause anxiety and depression. So pain is modulated and activated by our immune system. Our immune system manages inflammation and the pain response. And we're going to talk about a little bit later about how the endocannabinoid system, a system that regulates and modulates almost every part of our body, every organ and gland, how it also is very important in modulating and regulating the pain threshold, or even pain sensation, and even the response to inflammation. And we'll talk specifically about CBD, But CBD or cannabidiol works in this endocannabinoid system, so it can effectively not only reduce inflammation, but it is a natural analgesic or pain reliever, just like Tylenol. In fact, studies show that when you use a topical product like CBD or a transdermal product or a gel, it significantly reduces joint swelling and pain. So let's look at some of the dangers of acetaminophen or Tylenol, because again, Tylenol is a drug that many of us take that we absolutely have no idea that it can be very, very dangerous when it's inappropriately used chronically, or if it's used on a consistent basis and we're using too much of it. We're getting past that legal or that safe limit of ingestion of Tylenol. So no more than 4,000 milligrams per day. We see that Tylenol accounts for over 56,000 emergency room visits. Is this crazy? I mean, again, you think about a medication that you don't need a prescription for. This is something we all go to the Walgreens or CVS for, and we absolutely never think that it can cause an emergency room visit. It accounts for 26,000 hospitalizations, and over 458 people die annually due to acute liver failure from taking too much Tylenol. And what's even more interesting is that Tylenol or acetaminophen is found in a lot of other medications. So you may be taking medications that contain something called APAP. Whenever you see that abbreviation, APAP, that means that that medication that you are taking contains acetaminophen. So that additive effect, taking more than 4,000 milligrams per day, can lead and may lead to an overdose. Just a really scary thing when you think about Tylenol being a very safe medication. So let's look at the connection between Tylenol and CBD. Well, the connection is that recent studies show that Tylenol also has activity and receptors within the endocannabinoid system that is involved in relieving pain. So surprisingly, these studies found that Tylenol relieves pain through the CB1 receptors that we'll talk about in the brain in the endocannabinoid system, just like CBD does. In fact, acetaminophen or Tylenol pain relieving properties are blocked when cannabinoid receptors are compromised. And what that means is that when our body is not producing the normal level of cannabinoids that it can, then acetaminophen has a harder time to get those receptors to work. But CBD, we'll talk about, cannabidiol actually helps to boost the function of the endocannabinoid system, which increases the body's response to Tylenol. So when we talk about CBD, we'll see how CBD, cannabidiol, is a safer choice for relieving pain, for relieving inflammation that is due to either neuropathy, arthritis, plantar fasciitis, gout, complications and symptoms that those who suffer from fibromyalgia or lupus may see in their life. So let's talk a little bit more about the endocannabinoid system before we get into our product line at Wakanna that really is an absolute viable option for pain and pain relief and discomfort instead of taking Tylenol. So when we talk about the endocannabinoid system is deemed the most vital regulatory systems within the human body. In fact, this system was discovered in the early 1990s. This system is made up of a group of molecules called cannabinoids and their cannabinoid receptors. There are about 80 plus compounds that the cannabis plant makes. These receptors, CB1 and CB2, as well as receptors in every single organ and gland in our body, is looking for cannabinoids. They're looking for CBD, they're looking for CBG, CBN, and THC. These are all of the compounds that are important that the plant produces that are one, non-psychoactive, that give you the relief from pain. Again, the endocannabinoid system keeps our body stable, keeps our body in balance, it keeps our body in homeostasis, and it keeps our body from inflammatory insults that we see each and every day when we undergo environmental stresses, when we undergo issues that relate to arthritis, all of the autoimmune diseases as well. These functions control how we think, how we feel, and how we react. So let's look at the other receptors outside of the brain and the central nervous system and the periphery. And these receptors are not only found in the eyes, but found in the lungs, the liver, the kidney, the bowel, the skin, the stomach, the teeth, and the heart. These receptors are found in our bones, in our adrenal glands, in our endocrine glands, in our reproductive glands. They are found in every single organ and gland in our body. So as we talk about CBD versus Tylenol and using it for pain, we've already discussed the possible risk and side effects of using something like Tylenol and overdoing it, and even a chronic use of Tylenol causing liver damage. When we talk about CBD, CBD also has potential side effects and issues, especially when we look at the fact that you can find CBD everywhere. Since the 2018 Farm Bill was passed, we see CBD at the gas station, at the smoke shop, at the beauty shop, at the barber shop. But it's important that you know that not all CBD is made equally. In fact, most of the CBD out in the marketplace is not even tested. And another portion of the CBD that you'll find in the marketplace doesn't even contain CBD. You will see a lot of hemp seed oil that is marketed as being CBD. Hemp seed oil contains a lot of nutritional components, but it does not contain cannabidiol or CBD. So our products that we're going to talk about at Wakanna are products you can trust. They provide some of the most rich medicinal hemp that are fully compliant with the State Department of Agriculture regulations. And why that's so important is because hemp is a bioaccumulator. When you plant hemp, it can potentially take on any heavy metal, mold, mildew, or pesticides that can be in that soil. So it's important that the product that is being used is compliant with the State Department of Agriculture regulations, and those regulations are enforced that the hemp is grown organically. Our products are sourced from farms that are growing organic hemp. Those farms are in Oregon, Colorado, Kentucky, and we do have a farm in Northern Europe that's been growing hemp organically for over 100 years. Our products are industrial hemp registered, as well as our products are compliant with the 2018 U.S. Farm Bill. Now that Farm Bill states that hemp, CBD, has to be extracted from industrial hemp, which is defined as containing 0.3% or less of THC. 0.3% is the legal limit currently in the United States, and the 2018 U.S. Farm Bill after 80 years, descheduled hemp, and no longer is hemp a controlled Schedule 1 substance. So now CBD can be used, cultivated, it can be sold on a federal level in all 50 states. So again, this is our product line. Tonight, we're going to concentrate on products that specifically align themselves with reducing pain, reducing inflammation. Now, our product line has two crown jewels, as we speak of them, and that is our power line. Our power line contains the legal limit of THC, which is 0.3% or less, and our power line is full spectrum. And full spectrum is very important because full spectrum not only synergistically blends all of the cannabinoids that are important in reducing inflammation and pain. Those cannabinoids are CBD, CBN, CBG, and delta-9 THC, or tetrahydrocannabinol. The full spectrum products also contain terpenes. Terpenes are what gives the plant its aroma. So when you use our products, you can just smell the terpenes. You can smell that skunky, woody, citrusy sort of aroma that the terpenes produce. Now, our pure line, which is our broad spectrum line, is a line of products that you see in the white labels. Those are products that contain less than 0.0% of THC. So if you're on the line and you're looking for an alternative to Tylenol and you have random drug screens at your place that you work, then you're going to use our pure line of products. Again, the pure line of products are our broad spectrum products that contain the same cannabinoids and terpenes, but those products contain less than 0.0% less than 0.0% of THC. We'll get into our product lines, but everyone loves to infuse their food, their brownies, their baked goods. And again, another great way to get relief from pain, relief of inflammation, by even using CBD and infusing it in your beverages and your baked goods and food as well. So we're going to change slides one more time because for some reason my slide deck did not load the entire way, but no worries. We're going to get into our product line and then we're going to get into some questions. I'll open up the lines for you. In fact, you can start jotting down your questions as I'm going over these products in the little chat area. There is a chat area that you'll see that you can start jotting down your questions. So our first product that we're going to go over is our topical. It's a topical product. It's called our Extreme Relief. It is 200 milligrams of CBD cannabidiol. Cannabidiol, again, is the second most common compound that the cannabis plant makes. Now, it's a little different from THC. THC is tetrahydrocannabinol. THC is the part of the plant that gives us that euphoria, gives us that high. But CBD, or cannabidiol, is the non-psychoactive part. It gives you more of the body high, right? It doesn't get us high, but it makes our body feel good. It decreases inflammation. It decreases pain. It decreases anxiety. It decreases seizures. It decreases inflammation not only in joints, but in the pancreas, in blood vessels. That's why those studies that show CBD being an anti-diabetic, it's all because it's a powerful anti-inflammatory in every organ and gland and cell in our body. So this is a great product that can be used topically to any area that's causing pain. This is 200 milligrams of CBD. It's in a base of shea butter, so it applies very smoothly and evenly. And what I love about this product is though it contains the legal limit of THC, which is 0.3% or less, it does not pass the blood-brain barrier. And what that means is that you can safely take a urine drug screen at your place of work and still pass it by using our topical products that contain that very small level of THC. And THC, quite honestly, is important to have in a product like this because THC does have anti-inflammatory and analgesic properties that we're looking for when we're looking for relief. This product also has 9 USDA certified organic essential oils and essential oils that have anti-inflammatory properties as well. Those essential oils that we have included in this product include black seed and turmeric. You know, we all love turmeric. Turmeric actually is a very powerful anti-inflammatory. This product contains peppermint, clove, eucalyptus, menthol crystals, just to name a few. You only need a little bit. It goes a very long way, and topical pain relief to local areas is a really good way to eliminate that Tylenol that you may be taking, or eliminate that aspirin or Motrin or Aleve or Celebrex or naproxen that you may be on. Now, our next topical product is our relief product that contains 500 milligrams of CBD. It is in a larger container. It's in a 60 ml jar. And it also is a great way to use CBD locally and topically. It is a power product, which means it contains the 0.3% or less of THC. The only difference is that this product does not contain as many certified organic essential oils. So this is a great product for someone that doesn't have severe pain or inflammation, but has mild to moderate pain or inflammation. So that's the difference between our extreme relief and our topical relief that you see here. Now, our very new product that's going to be available this week is our Power Liquid Relief. We call it Dr. Rita's Rub. Yes, the formulators coined this product, Dr. Rita's Rub. I love this product because this is a topical product, but it's in a oil-based form. It's in a liquid form. Some people like topical, more creams. This is for someone who likes more of an oil base. This is 200 milligrams in 15 ml jar. This has 20 USDA organic essential oils. So we're saying that this Dr. Rita's Rub is amazing. I'm telling you, for those who have severe conditions, you're gonna want the Power Liquid Relief for that issue. 1 to 2 drops is all you'll need in the area that you want relief, and that is going to last, those topicals last about 3 to 4 hours. You're able to repeat that as needed. Now, I always love to add to topicals, right? Topicals are for local relief, but we want to make sure that you're using at least 2 to 3 different methods of ingestion of CBD, right? So another way to take in CBD is via a vape. The reason vaping is so powerful and so effective because the onset of action when you take a vape cartridge and take a pull on it is within 1 to 5 minutes. We're talking about relief almost instantaneously. Now, vape cartridges have been on the news, right? We've heard about the numerous mysterious lung conditions and illnesses that have affected so many Americans. We've had at least 13 to 15 deaths from the black market products. The vape cartridges that the FDA sampled were from the black market. When you get a product from the black market, the source is unknown. Know your source. It's so important. Our vape oil cartridges use organic, again, double certified, third party validated CBD. Our vape oil cartridges are in a base of MCT coconut oil, as well as our vape oil cartridges are enhanced with turmeric and black seed. Let's talk a little bit about black seed. Black seed is a very powerful antibacterial, antifungal, as well as antiviral. Black seed helps to normalize blood sugar. It actually helps to improve the cells that produce insulin in our pancreas. Those are called the beta cells. Again, when we talk about diabetes, when we talk about heart disease, when we talk about arthritis, be it rheumatoid or gouty arthritis or osteoarthritis, it all comes down to a common denominator, which is inflammation. CBD or cannabidiol is the most powerful anti-inflammatory agent compound that you will find. Vaping, again, knowing your source, our vape oil cartridges are very safe here at Wakanna. This cartridge is 250 milligrams in a 0.5 ml cartridge. It's important to know more is not better. For acute pain, acute inflammation, acute swelling, 1 to 3 pulls on that cartridge is enough. Doing that maybe 3 to 4 times a day will give you about 10 milligrams of CBD on a daily dose. Our vape oil cartridges also come in a raspberry flavor, a very nice flavor for those who want a raspberry taste. This particular one is 100 milligrams in 0.5 mLs. Again, not as potent as the other Power Hypnotic cartridge, but again, a great way to relieve acute pain. We will very soon have our pure cartridges. Those, again, will be for those who have random drug screens at their job. Those pure cartridges will be available next week. If you have random drug screens at your place of work, please use our pure products only. We just rolled out our pre-rolls on Black Friday. This is CBD flower, fresh flower that is rolled into a pre-rolled joint. Again, it gives you all the health benefits without the high. You will not get high on our products. Our products have the very safe legal limit of THC, which is 0.3% or less. This contains 163 milligrams of CBD. So please don't smoke the entire pre-roll in one sitting. That's way too much CBD at one time. Again, if you like flower, if you like smoking, you have acute pain within 1 to 5 minutes, 1 to 3 pulls on this pre-roll is all you will need. Now let's move on to our tinctures. Our tinctures are products that are used underneath the tongue. It's important when you use a tincture that you hold the oil under the tongue for at least 60 seconds before you swallow. Why is that important? Well, the glands underneath the tongue needs to absorb the CBD so it can get into the bloodstream. Now, unlike vapes, which take 1 to 5 minutes to get into the bloodstream, tinctures take about 15 to 20 minutes. That's why I always love to have a vape on hand for acute pain. That's why I love to have the topicals for local relief. And I love combining those other two products with a third product, which is a tincture, which will be used 2 times a day. Now, our most potent tincture is our Hempranium MD. This is a more therapeutic CBD product that we offer, and it is more of a medicinal grade. It's 750 milligrams in a 15 ml bottle. That means that each drop, 1 drop, is 2.5 milligrams of CBD. So again, more is not better. But what's so amazing about CBD is the safety profile. We talked about Tylenol having the #1 reason of ER visits and liver damage. Well, CBD side effects include maybe a little dry mouth. You may get a little fatigue if you take too much, but certainly the safety profile is far more acceptable than Tylenol, Motrin, aspirin, naproxen, and Celebrex. This product should be taken in the morning, 3 drops in the morning, and then 3 drops in the evening. I always start my patients off low. I start them slow, and then after 4 days, if you feel that you haven't reached what we call that sweet spot, that spot where you're seeing relief of your symptoms, then you can go up to 8 drops in the morning and 8 drops in the evening, or maybe you want to just double it initially to 6 drops in the morning and 6 drops in the evening. All of the recommended dosing is on the bottle for you. Our next product is our Hempranium, 500 milligrams. So it's not as potent or concentrated as the 750 milligram bottle, but absolutely is a great product for those who have moderate to severe pain. Depending on your preference, will depend on the product that you choose. There are so many people that don't mind holding an oil underneath their tongue for 60 seconds before swallowing. This product, as the Hempranium MD that we spoke about the slide before, both of these products are enhanced with 3 essential oils. These products are enhanced with black seed, and we talked about all of the medicinal properties of black seed. Turmeric, we know that turmeric is another powerful anti-inflammatory. It's great for heart health. Turmeric is great for everything, quite honestly. And it's enhanced with peppermint, which gives it a very nice flavor. And peppermint also addresses those who suffer from GI issues like reflux and GERD. Again, this product, start low and start slow. 3 drops in the morning and 3 drops in the evening is a great way to start. Now, our Power Water Soluble. I love this product because this is a product for those who may not like holding an oil underneath their tongue. Instead, this product can be used in your water, your tea, your coffee, your smoothie, your oatmeal, whatever you're eating, whatever you're drinking. You can pop 3 drops of that in the morning and 3 drops in the evening. It's a water-soluble product that bypasses the first pass effect, meaning we have a special conversion to the CBD molecule that makes it more easily metabolized without having to go through that stomach, liver, and then to the bloodstream. So that's our water soluble. Again, it's 500 milligrams in 15 ml bottle, meaning that it is 1.67 milligrams per drop. So we're going to have to quickly go to, I'm not sure why my slides did not fully load, but we're going to go to another screen here just so I can show you our other products. The other product that I want to talk about are gummies. We talk about that there are different ways of using CBD. The first way we talked about was our topical. That means you take the product and rub it on any area that's causing pain or discomfort, inflammation, or swelling. The second way you can ingest CBD we talked about is either in a tincture form or water soluble. Another way is our gummies. Our gummies come in the pure, which is the white label. That's for those who have random drug screens at their job. And our gummies also come in our power. Our power is the product that has the black label that contains the legal limit of THC. Again, none of our products will get you high. Why? Because CBD or cannabidiol is the non-psychoactive part of the cannabis plant. Now, gummies they take a little longer to metabolize. So gummies take about 45 to 90 minutes before you feel the effects. So gummies are a great product to take for inflammation and pain at night. I take a gummy every single night because as I'm sleeping, I know my body is repairing itself and those anti-inflammatory properties are working in that gummy while you're asleep. Our gummies are vegan. They're non-GMO. Our gummies contain 25 milligrams of CBD in each gummy. Again, our gummies are infused. They're not coated. When they're infused gummies, which are unique for Wakanna in the marketplace, that means they are more potent because the CBD is infused within the entire gummy. Our gummies come in a 4-count pack and they come in a 20-count bottle. Again, more is not better. You only need one gummy. Allow the gummy to work before you take another gummy. Now, another great product for inflammation is our body cream. Now, when we talk about inflammation, sometimes inflammation can occur on the skin, right? So our body cream will address inflammation on the skin. That is inflammation due to psoriasis, eczema, or even acne. That's our Power Mango Body Cream. It's 500 milligrams of CBD in the entire bottle. It's a great product, again, if you have any inflammatory process that's going on in the skin. Even our Power Cherry Bliss, our CBD lube, is a great product for those who have issues that surround sexual dysfunction. This is a 400 milligram of CBD in the entire bottle, and it's used on the outside of the vagina. There is a condition called vaginismus. Vaginismus is when it's very painful, inflammatory process that occurs in the vulvar area and the vagina. So this Power Cherry Bliss, because CBD is a powerful anti-inflammatory, because CBD is a pain reliever, this Cherry Bliss will alleviate pain due to sexual dysfunction when it comes to intercourse, right? If the vaginal area is dry, sex is painful. CBD lube will come in and be an analgesic, will be a pain reliever, as well as it will be an anti-inflammatory agent to help those with vaginismus or even vaginal discomfort and vaginal dryness. So right now I am going to open up the lines. I want you to use your chat for any questions that you may have. And I'm going to stop sharing my slides here. And let's see what we have in the chat. So let's see. Hello, what you recommend for a 90-year-old? Okay. Will CBD help clear up floaters in the eye? Floaters in the eye could be a result of a lot of things, but we know already from the slide that there are receptors in the eye. Remember that chart that I showed you here, that the endocannabinoid system has receptors in the eye. So those receptors, let's see here. Those receptors absolutely are looking for CBD to decrease inflammation, to decrease pain, to decrease any inflammatory or any issues that can be due to excess pressure that we see like in glaucoma, as well as cataracts as well. So CBD absolutely can help floaters in the eye. We can't make any claims of cures, but absolutely those receptors should be fed in the eye. What would you recommend for a 90-year-old cancer patient? I'm not sure what type of cancer. The doctor has given her 6 months to live. Well, we know that cannabidiol, CBD, actually is an anti-tumoral. There are studies that show that CBD helps to decrease the metastasis of cancers. Also, CBD works on the pathways in the brain to help relieve anxiety and depression. Anyone with cancer probably has some form of clinical depression, anxiety, inability to sleep. So CBD will actually help with those symptoms that many patients who have cancer, even with nausea and vomiting, if that person is undergoing treatment for cancer, chemotherapy, even helping to produce a better appetite, all of those symptoms can be absolutely addressed with CBD in someone who's 90 with cancer. Vaping while you have a cold, I tried it, and within minutes or less, I coughed up mucus. I used the hypnotic. I figured that it helped due to black seed, turmeric, and peppermint. The gummies with the beef gelatin, are they also vegan? So no, beef gelatin would not be vegan. We do have our gummies that are vegan. The pure gummies are vegan. CBD is an antibacterial, it's an antifungal, as well as antiviral. So yes, if you vaped, you probably did cough up all that mucus. If you had a cold and the cold was due to an upper respiratory infection, which is viral, yes, CBD being an antiviral would probably be the reason why you are feeling better after vaping. Can CBD help with schizophrenia, where there are studies that show that mood disorders like schizophrenia, bipolar, anxiety, depression, panic attacks, and even PTSD is improved with CBD. Why? Because CBD has been shown in research to work on the serotonin and dopamine pathways in the brain. Those are the pathways that modulate the activity of mood. I don't understand the question, but it says, how many puffs on the pre-rolls are recommended? 1 to 2 puffs on the pre-rolls are all you need at one time. Please do not smoke the entire pre-roll. That's way too much CBD. If you get too much CBD, you may experience extreme fatigue and maybe dry mouth. So don't smoke the entire pre-roll. Explain how active is the THC in the power products. Not understanding exactly what that question's saying, but the level of THC in our power products are the legal limit, which is 0.3% or less. THC has medicinal properties, not as many as CBD, but THC helps to reduce inflammation. THC helps to reduce muscle spasms. That's why those with multiple sclerosis those who have movement disorders like Parkinson's and tremors. THC helps to improve the appetite in those who have HIV/AIDS or may be undergoing chemotherapy. And THC helps to reduce pain. It's very powerful in those who have seizures and convulsions. So THC has medicinal properties, but remember, THC is the legal limit, which is 0.3% or less, is contained in our power products. Is tincture good for high blood pressure? Well, we know the studies that show CBD is a vasorelaxant. CBD is an anti-inflammatory. Again, chronic illnesses like high blood pressure, diabetes, heart disease, arthritis, be it rheumatoid, osteoarthritis, lupus, fibromyalgia, all of those disease entities, the common denominator is what? Inflammation. So the blood vessels in the heart, the blood vessels are inflamed. So CBD, not only being an anti-inflammatory, but being a vasorelaxant, it's coming in and relaxing those vessels that are constricted will decrease blood pressure, will decrease the blood pressure. Starting low and starting slow is very important. Those out there who have high blood pressure and are taking CBD, start low, start slow, 3 drops in the morning, 3 drops in the evening. Check your blood pressure regularly because CBD will improve your blood pressure. Is CBD safe for children? Yes, CBD is safe for children. You need to dose children as it relates to their weight. Most children over 25 pounds can be dosed with our products. If you need a dosing chart for children, please contact me by emailing me at drritamac@yahoo.com. That's drritamac@yahoo.com. Can CBD cream be used on toddlers for eczema? Well, whenever you use any product topically, especially in a child, it's really important to do what we call a skin test. That means that you take a little bit of the lotion and test it on the skin to ensure that there are no sensitivities to the ingredients. Is the body topical cream good for acne? Yes, our mango topical cream is good for psoriasis, acne, eczema. It's good for any fungal infections on the skin as well. Can you get a yeast infection using Cherry Bliss? You should not get a yeast infection using Cherry Bliss because CBD is an antifungal, it's an antibacterial, and it's an antiviral. So it's going to help with any issues that are coming from a fungal infection and not causing a fungal infection. What would you recommend for someone with high blood pressure, swollen ankles, and a continuous cough? Well, we talked about all of those things. We talked about combining a topical, that extreme relief, locally to areas of inflammation and swelling. We talked about how CBD is a vasorelaxant, so the tincture twice a day. And we talked about also using the gummies at night. The gummies at night are imperative to combine with your program. Why? Because your body heals when it gets into rapid eye movement sleep. That's that deep sleep that we need for our bodies to heal. When we sleep, our body is healing. It's taking care of the inflammation. It's taking care of the swelling. It's taking care of the anxiety. It's taking care of the pain. So absolutely use tincture as well as the gummy, as well as the topical, and of course, that vape cartridge for acute issues of pain. Is the mango cream good for keloids? Again, keloids are a result of an inflammatory response. Keloids, again, are a response to an inflammatory process. CBD is a powerful anti-inflammatory. It's a powerful analgesic, pain relief. So tonight we talked about how Tylenol and other over-the-counter pain medications like aspirin and Motrin and Aleve and Naproxen and Celebrex we typically use for pain and inflammation. Well, CBD is a safer alternative to those medications because those medications we see, one, Tylenol is the #1 cause of ER visits for GI bleed and liver failure. If you cook a meal for the family, can everyone eat it? Well, you have to first consult with all of the people that are eating your food, right? You wouldn't want someone who may have random drug screens eat some of the food that you've infused with the Power Line product. The Power Line product contains 0.3% or less of THC. So please, before you infuse food, ensure that everyone in the family is on the same page with CBD. Would you recommend stopping the prescribed medication while taking the CBD, specifically thyroid medication? Absolutely not. I never, ever recommend stopping any prescribed medication, and I hope that you out there do not stop taking your medication. You have to take your medication, but you can also take CBD with your medication. If you're on medication, if you're under a doctor's care, if you're pregnant, if you're nursing, please consult with your physician before taking any nutraceutical products, right? So it's important because CBD has been shown to improve so many chronic conditions, including thyroid conditions, and you want your physician to know why you are getting better. Your physician will work with you once your physician knows that you're on CBD to start decreasing the dosage of your prescribed medication. So please, if you're out there, do not stop taking your medication. You should take your medication as prescribed, and an hour later, use your CBD. That is the way that I instruct my patients to take their CBD with their medications as we are titrating and decreasing. Now, because I'm not your physician, you all on the line have your own personal physician. Dr. Rita is not your physician. That's why it's important, if you're on medication, if you are under a doctor's care, that you consult with your physician. I can't stress that enough. If you're on medication, please don't stop taking your medication, and please consult with your physician. I'm currently taking Zoloft, but have noticed my anxiety has been decreasing, and I have been taking a lower dosage. So that is really great. I think you're saying that you are on Zoloft and you're taking our CBD products, and you're noticing that your anxiety is improving and that you are having to lower your dosage. I see this each and every day. Hundreds of patients in my practice have been able to decrease and absolutely, in some cases, eliminate their medication. So again, please speak with your physician. One last question, and it's about multiple sclerosis. Multiple sclerosis, or MS, has been shown to be improved with cannabinoids, with CBD and THC. So if you're out there and you have MS, actually the Power Line with that 0.3% or less would be a great product. You can use that in any form and method of ingestion that you feel comfortable, right? There's some people that are out on the line that love putting things and infusing things in their food and beverage. Well, that person would use the water soluble. There's some people out there that absolutely love using an oil, a tincture. That person would use our under the tongue tincture. And then there's some people that like to cook. They like to bake. They like to infuse. So we have a product called our Culinary Plus that you can cook and bake and put your CBD in. And then there's some people out there that just want to use a vape. You know, they have these acute onsets of lupus or gout flare or maybe migraines or headaches. They used to be a past smoker and they want to use our pre-rolls or our vapes. It depends on you. It depends on your comfort level. It depends on your choice of product that makes you more compliant, and that's the one you're going to use. But if you're on the line and you have pain, you use Tylenol, you use aspirin, you may use Motrin or Aleve or naproxen or Celebrex or Tramadol or Vicodin or Norco. If you're using a pain medication, I encourage you to incorporate CBD and use CBD as a safer alternative for your pain and discomfort. I recommend that you use all three methods to address pain and discomfort, especially if you have severe rheumatoid or severe osteoarthritis or severe lupus or fibromyalgia or severe MS. I recommend that you use our topical, which will give you that local relief. I recommend that you use one of either a tincture or water soluble. And I also recommend that you have a vape on hand for acute onset of pain. Vaping's onset of action is within a minute. So you want to make sure that you have that done. And the whole time I thought my video was on. My video wasn't even on. You can see my new short haircut. I thought my video was on all the time. And then I highly recommend that you use a gummy at night. The gummy at night, again, will help you sleep and will also help your body repair as you're sleeping, because the gummy with the CBD will decrease inflammation, which is a reason that a lot of us wake up in the middle of the night, right? We're waking up in the middle of the night because of pain. So a gummy at night is a nice combination for your local relief with the topical, with your tincture or water soluble, and with your vape as well. So we've run out of time. I'm going to type my email address here. So if you have any further questions, you can email me. But whoever invited you on the line, you're going to want to get back to that person. That person really loves you. Let me tell you that. That person cares enough about your pain getting resolved than anything. You want to contact the person that invited you on the line so you can get your products ordered, and you can get them ordered tonight so that we can see you next Wednesday for a great testimony. You can let us know how our products are working. So I think that that's my wrong email. So it's Dr. Rita Mac at yahoo.com. So whoever invited you on the line, they have my contact information as well. And you want to contact them, get right off this line and call them, whoever recommended you to this webinar, get your products ordered, and we'll see you next Wednesday. Shoot me an email. Let me know what topic you want to hear next Wednesday so we can really empower and impact our loved ones, our colleagues, our coworkers, our family about the true story of the medicinal properties that cannabis has through CBD, which is the non-psychoactive part of the plant. Good night.